Good evening, everybody. Thanks a lot for being with us tonight. We have the great pleasure to welcome for this live around the eyes and the eye region, Dr. Michael Gorge, a plastic surgeon and very famous in Paris. Thanks a lot, doctor, to be with us tonight.
Hello, Quentin. Hello, everybody. I'm happy to be with you tonight.
Great.
And let's start.
We're very happy to have you on board. Once again, thanks a lot for being with us tonight. Don't forget that you may ask any question that you would have on our website, www.cible-formation.com. We have a live chat and we will do our best to answer any question you would have live on our show. Thanks a lot again, and Dr. Gorge, the floor is yours.
Thank you. Tonight we'll have Sylvette. She's 65. She never had any treatment, any injectables or any surgery, and she wants to improve her periocular region. So, Josette, would you sit, please? Her expectations are improving the hollowness of her eyes and maybe having a lifting effect on her brow, her temporal region, and everything that could open the look. We'll start to mark the anatomic regions, the limit of the lower eyelid, so this is the first region that is marked. Then the periocular region will be the limit and the junction between the brow and the lower eyelid. Then touching the bone will mark the limits of the temple region. We'll have the zygomatic bone. And then the temporal crest. Basically, when we look at her, we can see that all the temporal region is empty. It still lets the trace of the finger. Another point that we have to take in account in this specific patient is that her skin is really thin, and thus we have to be very careful because she will have easily bruises, and she also will have any imperfection could be seen. So in her case, we'll choose products that will be really moldable, and that's the case with the Filorga products. They are all very moldable and with a good cohesivity. So we'll start with the temporal region. Could you lay down, please? We'll start on the right side. The temporal region is an interesting region to treat because you have two ways of treating this region. The first one that most of the people know is the shotgun technique. This technique is easy to perform. You take a needle, you take your product, and you go straight to the bone and you inject it. In this case, I will show you my favorite technique. My favorite technique is a cannula injection with the universal in this case because she has such a thin skin that we want to be able to shape the temporal region perfectly. We don't want to go deep, put a volume, and then that all the product go lower or in another place. So in her case, we are going to take the universal with a 25 gauge cannula. As you can see, I will choose an entry point so that my cannula will fill all the temporal region. We'll make an entry point with a 22 gauge needle. Or, I don't know if it was enough. We'll make it a little bit bigger. The entry point is made. And the trick is that you have to go with the needle deep enough to go in the muscle, so you will see the tremulations or feel it if you take your finger on the skin. Since the entry point is made, you will have to go in between the two fascias. meaning between the deep and the superficial temporal fascia. This is the easiest way to be safe because all the vessels, the arteries and the nerves are more superficial. Now I feel a little bit of resistance, which means I am against the fascia. So after this, I go up really easily. You can see there is no pain in going in this region. And with a fanning technique, by retrotracting, you inject your product. And as you can see, you make some lines in between the fascia. But this is not very important because the space between the two fascias is an avascular plane. And while injecting the product, you will have a pressure between these two fascias and a correction of all this region without using too much product. When you use the shotgun technique, you will generally need more volumizing products and you will lose a lot of product because you will have a little bit of the diffusion in the anatomic plane. You'll have a diffusion through the temporal muscle and some loss of product behind the zygoma. So I just continue on injecting, as you can see, making all my lines, all my fanning technique. It's really easy. I don't have to put much pressure on my finger. It goes very easy and all the fascia reacts very easily. As you can see, you just feel all the region that you prepared between the two blue lines. Okay, let's go a little bit more. Up. Retrotracking injection. You don't have to be afraid because there are no vessels. And this is the safest plane to inject. If you are too superficial when injecting, you will have a lot of deformation of the skin. You will have some bubbles and some... For example, now, if I go out and I try to be more superficial, you see that I can't go under the skin. I will meet a vessel or something. Whereas when I'm deep, and I have to find my fascia entrance, that's here, it's very easy to go up. Perfect. So we used 1.2 milliliters of universal, which is very good for correcting all this region.
Dr. Gorge, we have a question from the web,
Yes.
if I'm correct, from London. We've seen during our partnership with FilmMed a lot of different products that have been used.
Yeah.
Here you use once again the Universal. Can you tell me, according to you, why it's the best product from the FilmMed range?
The universal product is really interesting because it has a good volumizing effect, not as big as the volume from FilmMed, but the cohesivity is very good. So I like to use it in this region because in her case the skin is really thin and it will attract water. Is this kind of patient, you know that when you inject her, exactly this region you have to be perfect. Volume will be too volumizing for her. She already has a little bit of round face, and you don't want to have a too much volumizing effect in her case.
Okay, thank you, Dr. Gorge. It's very clear.
Thank you. So, when we finished with the temporal region, I let in my syringe 0.1 ml. I will use this 0.1 ml in order to lift a little bit the eyebrow. The lifting of the eyebrow is quite complicated. It can be complicated in surgery and even by injections. In fact, the important point is using your fingers to feel the temporal crest. So it's exactly just above or a little bit under the eyebrow. It depends on the position of the eyebrow. In her case, I can feel the temporal crest right here. This injection is quite easy. You can feel the temporal crest, lift a little bit up, and just inject in this region a little bolus. You can see it very good, it's here. And what is really good about the universal product is that it's really moldable. So just a pressure of the finger, and you can't see it anymore. It's already perfectly placed in this region. I'll have another syringe of universal because the 0.1 weren't enough. We'll have to go a little more.
We have a question from the US, Dr. Gorge. How
Yeah.
do you realize that you are in the correct zone to do the injection? Is there a tip that you could advise our audience?
Yes, sure. Concerning the temporal region, you have the skin, then you have a fat layer, which holds all the vessels and the nerves. Under you have the superficial fascia, the deep fascia, the muscle, and the bone. The perfect plane is between the two fascias. So when you take your needles, you will go straight to the skin. After the skin, you will feel a little bit of resistance. This will be the first fascia. When you go through, you will go through the first fascia, second fascia, and then muscle. When you pull out your needle, you take the cannula and you go through the same holes. In fact, the first hole of the fascia will be hard to find. When you find it, it will be quasi impossible to go through the second fascia because there is a little bit of gliding effect between these two fascias. So taking the tip of your cannula, just feel the pressure that you have to go through the first fascia, and then you are definitely in the right space.
Thanks a lot. Very clear.
Thank you. Okay, so we are going to go on with the eyebrow. So a little bit here, lifting up. In this region, you are a little bit in the muscle, and you are also above the junction with the temporal fascia. So this bubble that you can see here, you mold it just a little bit, and you will have the lifting effect. So with these two techniques, you can have a good improvement of the temporal region and of the brow. The other concern of this patient was the hollowness of the eyes. Guys, I want to tell you something. Hollowness is easy to treat. It may seem scary, but it's quite easy, especially the upper eyelid. The upper eyelid can be difficult or tricky, but in fact it's not. It's really easy. You just have to pick the right spot of entrance, and then, for example, in her case, you can see, I will show you on her skin. In her case, as you can see, all this region is a little bit empty. The eye, you can see the fat pad that is here, and here you have all the emptiness. In fact, it's quite easy. In the upper eyelid, you have the skin, the muscle, a little bit of fat. No big deal. So, you want to make an entry point that will be far enough so that your cannula may reach the region that you want to be the more medial correcting. She has the fat pad. I want to correct, let's say, from this point to this point. I will make just an entry point here. Just go through the skin. Quite easy. You have to wait a few seconds just to see where the entry point was. It was here. And then look how easy it is. Just hold the skin, go through. Is it painful? Est-ce que ça vous fait mal? No, she says it's not painful. This is not a painful injection. And now, retro-tracking, you are somehow here in between the muscle and the skin. It's hard to say exactly where you are, if you are deeper or exactly in the muscle. In my experience, I noticed that generally the product goes in the anatomic region. Let's lift up. Look, you can see the product is here, all around. You see? And it didn't move. It stays. Because even the fine lines is a good product and has a good cohesivity. That's why it's the best choice in the periocular region. The best choice when you have thin skin and you don't want to have any problems, you take the fine lines. It's the best product.
Doctor, we have a question from Brazil
Yeah.
asking, how do you make the choice between the needle and the cannula? How do you pick the best technique?
In fact, I try to use safety techniques. With a needle, you can always puncture a vessel, except if there is a region where there are no vessels, or I am really sure that there are no vessels. Except from this, I will take the cannula. I feel safer using something that is not able to puncture my vessel.
That's fair enough.
Thank
you, Doc.
Okay, so look, when we put up, we saw the project, we made a little bit of massage, and now we hardly can see it. And the region changed already. You don't have this hollowness here. We can do the same on the lower eyelid. The lower eyelid is also known to be dangerous. It's not that dangerous, and I will tell you why. In fact, a lot of people are afraid in this region because they have the infraorbital nerve. The nerve is somewhere here. I will draw it in white. People are afraid that when they will inject this region, they will go directly in the nerve or in the vessels or in the artery or in the vein. In fact, this injection is quite easy to do. In her case, we'll make exactly the same thing. We'll make an entry point with the needle. I will choose this point exactly in the same spot so that the tip of my cannula will reach the so that the tip of my cannula will reach the corner of the eye. Okay, a little bit of bleeding, and then with your cannula, you take the same entry point and you go up. I will take in this case a 25 gauge cannula. You can use a 27. I prefer the 25 because it's a little bit bigger. I will have to make a little bit the entry point again. Tack. Perfect. Taking the 25 gauge cannula. And now you have to be a little deep. You don't have to be too superficial. If you are too you will feel the first pressure that you feel is the muscle. You go just a little pressure and you go deep. Now it's deep. And I go straight to the middle. And when you feel the bone, is that you are close to the nose. And then retrotracking and injecting exactly here. You can see how I inject exactly under the blue color, under the junction of my lower eyelid. That's here. And that's the region that I want to feel, all the hollowness. And what is amazing with the fine lines product is that it doesn't attract water, so you don't have any danger for edema. It's very, very nice. You get what you inject. That's what I want. I want to be really precise, I want to inject something, and I want to control my result.
Dr. Gorge, we have a small question coming from Italy. What is, in the main headlines, the plan of injection for the eyebrow?
You are in the muscle. In fact, I have been to the dissection room trying to see what happens, and I used colored products. And while injecting them, I was trying to be close to the bone. And this is very, very important thing, guys. Injecting close to the bone, you'll never get under the periosteum. You will always be in the muscle above the bone. So the product will stay in this muscle, in this region. So don't be afraid of using needle or cannula. It's the same, using needle or cannula. If you want to be straight to the bone, the product will be a little bit above in the muscle. So you have to be deep, that's the point. If you are deep enough, it's okay.
Good. Thank you, doctor.
So we had all this region treat. I'll remove the marking. And I will finish my fine lines by treating a little bit of all of the wrinkles around the eye. So in this case, I will use a needle because I will be just under the skin. The needle is really thin. I will use a 30 gauge needle. It's the one that comes in the box of the product. It's really easy, and there is a very interesting specificity with the Filorga products. They also have the best needles. They have the thin walls. They have the thin wall needles. It's the only needles that, after injecting the product, by retracting, you can have blood coming inside because it's a thin wall needle and it's very, very, very important. So you take the wrinkle, you inject it just under the dermis. It's so perfect that you just put your finger, a little bit of massage, and it's gone. It's amazing. I think this product is really amazing. It's the only one that you can use on such thin skin, because this patient is a really complicated one. Her skin is so soft and so thin that every mistake or every product that doesn't have the good specificities don't make a good result. So that's why it's important to have the best products for your practice. And that's why I chose to work for Filorga, because I know that they really prepare the best products. I'll make a little bit of this wrinkle too, and then we'll move to the other side. Here we are. We'll make a little bit of pose to compare both sides now, if you want, guys. I'll make her sit just to remove a little bit of the colors, and then make her sit so that you can compare. Vous pouvez vous asseoir un petit peu? Okay. Regardez devant vous. Perfect. You see, all the temporary region has been treated. The hollowness on the upper eyelid also. A little bit of the lifting effect on the eyebrow, and correcting a little bit of the hollowness on the lower eyelid.
Can you give us a very quick reminder while the patient is sitting of the product that you used and the quantities that you injected on the different regions?
In the temporal region, I had the 1.2 milliliters. This is very important because you only have this in the Filorga products. You have in the Universal and in the volume, you have. Yes, this is an important fact, guys. If you have patients that want to have 2 or 3 syringes used, when you use the Filorga products, you will have 1.2 milliliters per syringe, which makes, if you use 3 syringes, 0.6 milliliters more. And with 0.6 milliliters more of the same product, you can really treat a big, big region. So, temporal region, 1.2 ml. Upper eyelid was 0.3 ml of fine lines. 0.3 on the upper part of the brow, and 0.2 to 0.3 fine lines on the lower eyelid.
We might just ask our patient, how does she feel? Comment est-ce que vous vous sentez?
Très bien, ça va. Pas mal.
Est-ce que was it painful? Est-ce que c'était douloureux?
Non, 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 pas du tout.
Okay, merci beaucoup. Thank you very much.
Okay. What I like in my practice is to stay on the same side most of the time. So, same side, we'll make the same marking, limit of the lower eyelid, limit of the zygomatic bone, limits of the temporal crest, limits of the periocular region. So mainly, the region that you want to treat, the more empty point is here. So we'll do the same. We'll take an universal. with a 25 gauge cannula, entry point, and in this case, I will show you something. If you are here, you will take an entry point, move a little bit of your plus à droite, okay. What you want is to cover all of this region. You can make your entry point here. It can be a little bit tricky because you have the temporal artery somewhere here. But you can also make it up or hiding it at the limit of the hair. So going a little deeper.
Dr. Gorge, we have a question from Sweden. How do you choose this entry point? Can you give us some tips to know where the good entry point is?
Exactly. So what I want is not to be too far from the zygoma, because there is a region where the temporal fascia has a lot of tension and it's easier to go through the first fascia. When you stay close to the hair, the mobility is a little bit higher. So this one maybe will be a bit difficult, but it will be easier to hide it. If you go up, you will go close to the bone, and then the fascia will also be a little bit tighter and easier to go. So I will say, if you have to choose, take an upper one or a lower one. It will be easier. If you want to hide it and if you feel confident, try the middle one. You could hide the entry point in the hairline, but it will be a little more difficult. Let's see. Here I can't go. I miss the fascia. So I just have to look to find where the entry point of my fascia is. There it is. So now I continue to stay under, and I inject it retrotracking. And I know that I'm behind because you see I can't lift up the... This is an interesting, a good tip to know if you are in the right space. I was asked before, how do you know where you are? In fact, if you lift your cannula up like this, you see I can't lift it. It means I'm not under the skin, I'm under the fascia. And exactly the same, retrotracking, and I'm trying to feel all the region, but especially in the middle, exactly where I want most of my product to be. And you can see that it's really easy to feel all this region. And I think that this technique is a really interesting one because you use really less product than the shotgun technique. The shotgun technique, you will have lots of loss of product in the muscle, and with the gravity and the muscle contractions, the product will go from up to down. I've been trying to see how it's gone with colored product going to the laboratory of dissections, and I've realized that if you massage it strong, when you go deep with a shotgun technique, you lose a lot of product. And of course you don't want to lose product because you want to have the best result for your patient with the minimum product. So since I used one syringe on the other side, I will do exactly the same. You can see, especially here, I don't know if you see, guys, you can see a little vein here. I will show it to you with the tip of a needle. Here there is a vein, and here there is another one. And you can see, if I lift up, I'm really under this vein, which means I really am in a good plane. I'm under the fascia. I'm in between the fascias. And fanning. And good. There we are. And the entry point, the middle entry point, which is the more advanced one, is easy to hide. So you can see it. So this point, perfect. Temporal region checked. Let's go to the eyebrow. Un autre universal. Un autre universal, tu vois. While my assistant prepares the universal, we'll go to the upper eyelid. So we'll have the same treatment. we want to treat the region from here to somewhere here. On this side, compared to the other one, the fat pad is a little bit bigger. If we press it, we don't want to be around, we want to be up, just to smoothen the orbital rim that we can see here. So we want to be here, good entry point, here. It's quite easy. Just go through the skin. Perfect. And then you go straight to the region that you want to treat and retro-tracking. Again straight and retro-tracking. Perfect. I will come on the other side. If I lift up, you can see the product. It's here. Since it's fine lines, just use your finger. You can be under the skin. It will mold perfectly. It's the best product for moldability. And this injection, it may seem tricky, but it's very easy and very safe because you have no dangers here. No arteries, no veins, no nothing. Perfect. We'll finish the lower eyelid. Same entry point. Exactly the same as the other side, a little bit of bleeding, which means she has a little bit of veins. That was the tricky point with this patient. She has such a thin skin, and even though you can see the veins in this region. But let's see. I will take a 27 gauge, 25 gauge cannula, exactly the same as the other side. You see, a little bit difficult to enter because the hole is not big enough. We'll make it a little bit bigger, no problem. Perfect. And then go deep to the muscle. You see, this region is tricky because people say I don't want to inject with a needle. I had the question before, do I inject with a needle or cannula? In this region, injecting with the needle can be a little bit more dangerous if you are not an expert. So when you begin, it's safer to use the cannula. As I said before, 27 or 25 gauge cannula, perfect for this region. The rigidity is good, and we use 0.3 exactly as the other side. It's perfect. So lower eyelid treated, upper eyelid treated. Now we'll take the universal to finish the brow. It's easy. You just have to feel the temporal crest is here. You can feel it. Don't be afraid, lift it up. A little bit deep. Tack. Retro-tracking 0.3 and massaging it. Tack. Tack. That's what I like with the Filorga products, is that they have a very good cohesivity and their preparation makes them also very easy to mold. I think it's the best product on the market right now. So with the rest of the fine lines that we opened, we will finish a little bit of the superficial lines. And maybe because we want to improve the look, we would like to inject a little bit of the forehead, because all of these wrinkles. Regardez méchamment. Levez un petit peu la tête. Non, le menton. Et regardez méchamment. Parfait. All of these wrinkles, this one, are related to anger or astonishment or anyway, bad experience. But I want to show you something. The Fine Lines is such a great product that when you lift it up, it's called the vacuum technique, the product stays exactly under the dermis. Retrotracking with a needle. Perfect. Here. This region is interesting to treat. On the forehead I use the Fine Lines because in her case especially the skin is so thin. And look how good is the result. This region is also known to be dangerous, but it's a false problem because the artery comes from under the bone. And in the lower forehead, the artery is very deep. So staying superficial here is no risk. In fact, if you want to have a good treatment plan, you have to divide your forehead into two regions. Let's say a lower region and an upper region. The artery will come from here and going up here. Here is very deep, you are close to the bone. Here is very superficial, close to the skin. So when you're low, you have to be superficial. When you're up, you have to be deep. And that's why that's the best way to be safe. So all these wrinkles are done. An interesting point is that the cohesivity is still good even with the Fine Lines. So while injecting all of the superficial wrinkles, even this one here, the product will stay in the muscle. So while staying in the muscle, it will have a little bit of toxin-like effect, which means the result will improve over days. So the combination between moldability, not attracting water, and a little bit of cohesivity of the Fine Lines, it's the best product for the forehead and the periocular region, especially on thin skin. Okay, so I think we're done. Could you sit? Well, good improvement. Very good improvement. What do you think, guys?
So maybe just ask our patient, how does she feel? Comment est-ce que vous vous sentez?
Très bien.
Okay,
Ça a été
no
douloureux?
pain.
Non, pas douloureux du tout.
No pain.
So, no painful procedures, good results. That's all that we want to do for our patients. Best products, Filorga.
Thanks a lot,
Thank you,
Dr.
Quentin.
Gorge. Please, guys, I hope you enjoyed and learned a lot. Stay with us. We are on track for the second part of our live session for a Q&A with our plastic surgeon. Remember that there is the live chat where you can prepare and ask questions, and we'll try to deal with them just after the break. Please stay on hold, and we'll be right back. Thank you very much. Hi, guys. Hi, guys. Thanks a lot for being back with us. Live Cible Formation in partnership with FilmEd. Tonight, we treated the eye region with Dr. Gorge. Thanks a lot, Doctor, for being with us tonight.
Thank you.
We had a lot of questions, but I believe first we should have a little check at our patient, and I believe the result is pretty astonishing. What do you think?
C'est parfait. Je trouve ça très, très bien.
Alors, the result is perfect, and she really likes it. And by the way, we were discussing during the break, absolutely no pain. So a great job by our surgeon. So we will start with the first question that we actually had from Spain. What other technique can you use to optimize the result?
In fact, you have to be sure of what you do first. And the analysis of the look and of the face is very important. You have to know that the eyes are in correlation with the brow, the temporal region, the cheek, and the nose. And whatever treatment you will do on every one of these regions will improve something on your eyes and on your look. So the best treatment is the one that will improve the most one region and will have an effect on the look. We have seen the temporal region, so my favorite technique is using universal with a cannula, generally 25 long, let's say at least 55 millimeters, and in between fascia. This is the
Can you
first
just
technique.
show us where the region concerned is?
Yes, so in her case, I will come here. In her case, it was all the temporal region, this region. The second region close to the eyes is the lower eyelid. What other specific treatment can we do? You want to fill this region because it's where the tear trough is. So we've seen it. You do it with a cannula, a lower entry point. Sometimes you want to treat also this region. It's the lateral part. You can do it with a cannula, same technique, fine lines, and just finding the junction between the eyelid and the cheek. In fact, marking the limits of the eyelid is the most important fact, because you will see if you have to fill it or not. Then, the brow. Injecting here. The injection should be deep and above the orbital rim, which will make a little bit of this effect. At last, one that is a little bit, seems at least a little bit dangerous, is the upper eyelid, the injection of the hollowness. Not all the patients have it, but with age, hollowness can be treated by injecting fine lines with an entry point that will cover with the tip of the cannula the most internal points. And if you want to treat these wrinkles, you will also use fine lines with a 30 gauge needle just under the dermis, superficial, because we've seen the artery starts up from here. So you want to be superficial in this region. Another point that we didn't discuss was sometimes you see that the limits of the lower eyelid is very, very low, and you have this impression that the eyes are very, very big. And like in her case, you can hardly see you can see the bone. You don't want to see the bone because the bone makes it a little bit empty, and it's not filled with life. So what you want is to fill and hide the bone, and you want to lift up this point. The lifting up point is an anchorage point, and in my practice I always think, do I need to fill or do I need anchorage? The anchorage point should be, let's say, a fictive example. If our lower eyelid was like this, and I wanted to lift it up, I would inject a bolus of product at the lower point, so just to lift up my lower eyelid.
That was very clear. We have another question, very interesting, from Argentina, asking about your behavior with the patients concerning the treatment. So, question being, are the patient asking you for the treatment, or are you suggesting, or whatever term it may concern and be appropriate, to your patient to proceed the treatment?
Yeah, interesting question. In my practice, when patients come, I have two categories of patients. The one that tell me, "Oh, you're the specialist. You have to know. You tell me." And some others that tell me, "I come for this special wrinkle." And it's really hard to manage both of them because it's really at the opposite from one to another. What I want to tell them is I want to translate in terms of emotions what they want. Do they want to look younger? Do they want to look more handsome? Do they want to look less tired? And I will try to make them speak these words so I can make a hierarchy between all of these parts. And I will treat the first that is the most at first I will treat what is most important for them. Let's say they say I look sad or I look tired, then I will go for the periocular region because that's where it comes from.
So it's basically trying to understand exactly how your patient feel and how you would make them feel better in order to address the right region.
Exactly, Quentin. It's translating how can you help them and listening to them and translating their emotions into techniques, because your techniques is a portfolio of techniques. That's why you have to come to these wonderful courses that you guys make in Cible. You will see different doctors. Everyone has a good technique because you will learn and start to make your own kind of techniques and then use your way of injecting and treating patients.
And another question we have is that we often talk about female patients, but for male patients, would you use the same technique, the same plans of injection, products, etc.? Can you enlighten us?
In male patients, there are a few specificities that you really have to take account. First one, you don't want to make round and faces, so you don't want to fill the temporal region too much. Men have to be full of life, but you have a virility. You know, the shapes are a bit less smooth. You have more angles, so you will enhance more the brow or the orbital rim, and you will make more anchorage points. It will be more boluses than fanning, and you don't want to make something really round because round is more related to female, and male have like bones, you know, and square face. That's the archetype of beautiful men. So I won't treat the temporal region. I will prefer to have an empty temporal region but have a good bone here, see more masculine. And another point to take in account is that more often men have a thick skin, so you can go with more volumizing products. For example, for the tear trough and for the lower eyelid, I will go with universal because the projection power will be better and you will have a better result in men. So that's the most 2 points in men.
We will finish with a question that we had from various countries, actually. I believe that all doctors, being very experienced and very knowledgeable like you, or more beginners, practitioners, have some questions about potential complications, how to avoid it, how to prevent it, and how do you see your patients after the treatments. Can you give us a little hint about that?
Yeah. I think, first of all, you have to be trustworthy to your patient. You have to be true, and you don't have to lie them. You have to tell them a complication can always happen. You can have a little bit of bleeding, some bruises, and it's not a complication-less job. If you don't have any complications, it means you don't do the job. So you just have to manage them properly and use the techniques and the products that are the best for your practice. That's why I think it's really important to use the best products, which are the Filorga ones, because let's say the rarest complication is the emboli. Well, it can happen to everyone, but the complication you want to avoid is the bruises, is the migration of product, and all these complications can happen with bad products. Infection also, not good sterility. Everything is important. So if you know that you have a product with a good cohesivity, you won't have migration. So that's why universal and volume are great. You want to have good sterility. That's why Filmed and all the Filorga brand work in very amazing products. So I think it's good, yeah, to have a good management of the complication, but also to choose the best products to avoid them.
Very clear. Thanks a lot for being with us tonight. It was the Cible Formation live session on the eye region in partnership with Filmed. We are waiting you on our next live on the 12th of February on the mid-face treatment. Meanwhile, we will give a great thank to Filmed and to our surgeon tonight, Dr. Gorge. Thanks a lot, Doctor, for being with us and this perfect live show. Thanks a lot for holding on. Please ask any question we wouldn't have the time to answer on our website, www.cible-formation.com. And we will be more than happy to have you with us on the other round on the 12th of February. Thanks a lot and have a good night.